Hi everyone, so I'm here in Sebastopol, California, and I'm at the home of Dr. Nadine Burk-Harris, and I'm getting ready to sit down and interview her one-on-one. Super excited. As you know, she wasn't able to join us in person because she had a very special invitation to the United Nations first anti-violence against children Congress that they're doing, and that's just something you can't pass up. But she was very gracious to allow me to come spend time to get to know her and to also be able to just chop it up a little bit and share some really valuable wisdom and tidbits with you. And as a free gift, we have a copy of her best-selling book, The Deepest Well, a fantastic book. And I'm so excited for you to be able to dig into that. And I hope you enjoy the interview.
Hi, everyone. I'm Dr. Nadine Burk-Harris, and I want to welcome you to the Adoption, Trauma, and Healing Conference. Y'all are about to do some very important work today. I'm sorry I can't be with you, but I want to let you know that I am grateful to each and every one of you for the hard work that you are doing every day.
Huge fan of your work.
Thank you.
Your message, your vibration that you're putting out in the universe. It's a different paradigm, and it is so important. So I thank you for that, and I'm grateful to be here in this room with you. The ACEs research says that 67% of adults have at least 4 ACEs.
Have at least one.
At
Yes.
least one, and then
Yeah.
12%
Yes.
have 4.
Mm-hmm.
And you noticed in your work that, first of all, you were doing research with kids, so by the time they were 18, they probably were going to have even more. But you also stated that there are a lot of, in my field, I call them traumatic stress events. There are a lot of events that even ACEs doesn't attest for. I've always said that, because we work with adopted and foster children, that 99, I say 99 to leave 1%, 99% of parents who are raising adopted and foster children with trauma histories probably have trauma history themselves. We just don't know it. And the thing I love about your work is you're bringing the adverse experiences to the consciousness of all of us. How important in your mind is it as professionals and as parents that we recognize how those same adverse experiences have impacted us?
Yeah, it's incredibly powerful. I will say that I answer this question both as a pediatrician, a researcher, a public health advocate, and as a mom who has experienced significant ACEs. And in our family, my husband and I have 4 boys. Our 2 older ones are adopted, and our 2 little ones were cooked in the oven. And what's really powerful is to see, for my husband and I, it has taken real work and intention to recognize our own ACEs and to be mindful that we are not handing them down to our kids. Because anyone who is caring for kids who have experienced trauma or adversity, and almost by definition, kids who are adopted have experienced some type of trauma or adversity in terms of just the loss of their biological parents. So one of the things that we know is that when we are caring for kids who have experienced adversity, the situation is just such that we may be more likely to become triggered, right? Like we may be more likely to deal with challenging behavior, any of those things. And so not only do we need to know about how trauma and adversity affects kids' development so that we can respond appropriately, but we also need to know about how our own ACEs, how we can get triggered by our kids, or how, where our sensitive parts are, so that we actually can be those safe, stable, and nurturing relationships that our kids need.
Isn't that some of the hardest work?
That is hard work, of course, because when you're dealing with a kid, children are so, sweet and lovable, and sometimes they're challenging, but that part, seeing and trying to meet the needs of your kids, that part is, I think, intuitive for a lot of us. I think the part that's really scary for us is looking back at our own histories and looking at ourselves now and recognizing, ooh, that's a sore spot for me. Or I really have to look at that thing that I've been not wanting to look at or not wanting to deal with for a really long time. And the powerful thing is that when we do look at it and when we do address it and do our own work about it, it just transforms our parenting.
It absolutely does.
Yeah.
And yet, I believe we have a society of momentum that makes it so easy to just focus on the child.
Yeah.
I believe the reason we focus on the child, I always say to therapists that I train, the reason we don't like working with parents is because anytime you're working with a parent, you're unconsciously working with your own parent. So it's so easy. It's so easy to just jump to the child. And one of the things I love in your book is when you were talking about Trinity, the second thing you addressed that you prescribed was family therapy.
Yeah.
You didn't prescribe play therapy or art therapy. You prescribed family therapy. And I have been teaching for 20 years that we have to help reduce the stress of the parents so we can help them become therapeutically available for their children.
That's exactly right. I recently reconnected with one of my former patients. She's a former foster child, and she's now an advocate, and she's speaking up on behalf of services for foster youth. And one of the things that she said to me recently that it made me really proud, but also a bit sad, was she said, when I came into your clinic, that was one of the only places that not only I, as a foster child, was treated with warmth and dignity and respect, but my mom, right, who was in and out of recovery and in and out of different interventions and engagement, she said, you were one of the few people who treated my mom with respect and dignity, right? And it's like, how can we expect parents to receive what they need to be able to be therapeutically available to their kids when we're not recognizing that undoubtedly many of the things that parents are experiencing are the results of their own adversity that they experience in their own childhood. And so it's just a matter of, sometimes I think we want to care for the kids, but then the parents are less sympathetic. And for me, when I look at exposure to ACEs and the fact that that can lead to a dysregulated stress response system, which is something that we need to treat, right? And that is handed down from parent to child. So I want to treat it in the child, but I also want to treat it in the parent.
You have to.
Right? Yeah.
Because in times of stress, we regress.
Right.
And if you don't treat that, then you have adult parents who are regressed and sometimes 2 years old, sometimes adolescent, trying to parent their stressed out 2-year-old or infant children.
That's right. And then what we see happens is folks say, oh, that stuff happened in the past, but I'm all good now. And it's like, okay, your stress response system is what you need when things get tough.
That's right.
And things are going to get tough. This is predictable, right? In life, people's parents die, people lose their jobs, when we experience stressors, right? If we don't have a regular practice of regulating our own stress response, then when predictable things happen, we get surprised by the result, right? Like, oh my goodness, we got thrown off by this. That's exactly right. And so that's one of the things that I want to bring a lot of awareness to, is helping everyone recognize and respond to if they have a dysregulated stress response because of what they've experienced in their childhood. How do they get supports around that, right? This is not something that's not treatable. This is one of the things that I get so excited about. It's one of the things that gets me up out of bed every morning, is recognizing that the science shows that when we have safe, stable, and nurturing relationships and environments, when we have the adequate nutrition, right? Things like a Mediterranean diet and all of, all that good stuff, the omega-3 fatty acids, when we have a good sleep hygiene and really, well-regulated sleep, when we are exercising 30 to 60 minutes a day, all of these things help to regulate our stress response.
That's right.
Yeah.
And that's essential because the parents today are under so much stress.
Yeah.
And 20 years ago, I said, I believe that parents are at an all-time high of stress. And look what's happened in 20 years.
Yeah.
And you can't be therapeutically available to your child and be regulated. And when I say therapeutically available, I'm just talking about be regulated and present.
Right.
If you're in a state of dysregulation.
That's right.
And so how do we create the supports for the parents who are tasked with the job of being regulated to create co-regulation for their children?
So, two things. The level of parental stress is at such a point now that we see that the United States Surgeon General just came out with an advisory saying, that's called Parents Under Pressure.
That's right.
They're saying that parents are at an unsustainable level of stress.
That's right.
And that many parents are experiencing so much stress that it's actually affecting their functioning.
That's right.
Right? And so when we see that many parents are under that degree of stress, we can say to the parents, you need to do better, you need to do better, you need to do better. Or we can take a step back and say, let's look at our systems. Let's look at how we are supporting parents to begin with.
That's right.
Let's look at the way that, for example, whether or not some of our policies and practices around childcare, like do we have adequate investments in childcare? Do we have adequate investments in paid parental leave? Do parents have access to mental health services, or is that not covered by their insurance? Yeah. Or is there a 4 to 6 month wait for them to get the resources that they need?
Let me ask you this on a living room perspective with a family, an at-risk family, with 2 or 3 children, 2 adopted, significant trauma, parents having significant trauma. Would it be regulating to help the family with nutrition, which you just mentioned and how important it is? What if you added massage? What if you added housekeeping? What if you added lawn care? What if you added handyman services? Would that be supportive of the child's regulatory system?
Well, it's easy to recognize that those things, the short answer is yeah, of course, right? Of course. What we see is that the investments that support parents to be able to be that therapeutic presence for their kids is an investment in the health and well-being of not only the child, the parent, right? But also the next generation.
That's right.
Right? And so this is where, when we look at one of the things that I've focused on a lot is around the cost, right? We look at, with many of these programs, we say, well, we can't afford to support parents in that way. We can't afford to have everyone have paid family leave. We can't afford to have, tax credits for parents and all of these things. But when we look at the cost of ACEs to the United States of America, have you heard the latest on this? Okay. So in December of 2023, the CDC came out with a report. They said the actual cost to the state of California is $1.5 trillion per year. Now, that's not how much money we're laying out. That is the money in lost productivity. That's the money that what happens when a person is incarcerated or dies early or ends up on disability because of an ACE-associated health condition, right? Which we know there are so many, from heart disease to cancer to depression, right? So nationally, that number is $14.1 trillion per year, according to the CDC. Wow. The cost of not only paying for the healthcare costs of ACEs, but the large majority of it is in this lost productivity. And so when we look at how do we make the investments to support parents, right, we recognize that we are paying right now. We are paying for every parent who's not able to be available for their kids, for every child who is at increased risk of health and mental health and behavioral health conditions, we are paying right now. And the question is, do we want to invest in better outcomes, or do we want to keep paying for the poor outcomes we've been getting?
What about when there is money available, yet there are regulations that work against neuroscience, neurophysiology, pediatric research, ACEs, that works against being able to provide the services that the families need to be able to achieve sustained regulation and to heal trauma and to keep children out of residential treatment centers? Sometimes it feels like the system is set up for kids not to be able to succeed and for families not to be able to succeed. And it's unfortunate because, Dr. Nadine, for almost 25 years, I've been teaching trauma-informed. Well, 10 years ago, when everyone started talking about being trauma-informed, I said it's too late. We need to be trauma-responsive because trauma-informed is a cognitive framework. What are you going to do when the trauma shows up? You have to know how to respond. And I feel like what happens because we don't understand our own ACEs or we're disconnected from it, then the application of it falls off. So everyone talks about it, but when it comes time to be about it, it's like everyone wants to do traditional stuff.
So that is, honestly, I'm going to tell you, that is the reason why when the governor reached out to me and asked me to serve as California's first Surgeon General, I didn't want to leave my community. I didn't want to step away from seeing my patients. And I said to the governor, hey, listen, this is such an incredible honor, but my focus is on ACEs and trauma-informed care and helping families. And he said, that's exactly why we want you. We want you to be moving this work forward. And that is the reason why I took the job, because I was not interested in taking a job so that I could have a fancy title and then we continue to do things business as usual. I'm not interested in doing that. When we know better, we need to do better. But the problem is that folks maybe are not as familiar, or they can be aware of the science and the data and the information, but they feel risk averse when it comes to applying it. If they don't know exactly what to do, or if there is not a course charted, then folks are hesitant, which I think it makes a lot of sense. But one of the things that I want to encourage people to think about is that the status quo is associated with harm. So people don't want to do something new because they're afraid that what they do is going to be harmful, or that there could be unintended consequences. And that's one of the things that I hear all the time. And for many of those people, I say, yes, but the system as it is associated with a tremendous amount of harm. So this is not a thing of like, oh, I don't want to do anything because it could create harm, right? Because there's harm that's happening right now. And so that's part of the reason why I brought together scientists from around the country and around the world to inform the Roadmap for Resilience, the California Surgeon General's report on ACEs, toxic stress and health. And that was to help folks have a framework, right? To say, okay, if we're going to move forward and do things differently, people need guidance, right? And so we want people to have guidance moving forward.
It has to be a new framework.
Right.
It's a new framework.
Right.
It's not the old framework.
Right.
So the guidance is in a new framework, and I think that's really important.
That's exactly right. So to help folks understand that, I think for a lot of people, many people don't even imagine that prevention is possible, right? The idea of prevention, early detection, early intervention. That is what all of the science says makes all the difference in the world. And these are the most evidence-based approaches. So, you know, I talked about safe, stable, and nurturing relationships and environments, nutrition, mindfulness, exercise. It turns out time in nature also helps to regulate the stress response. Supportive relationships, right, with people who we trust and care about, mental health interventions. All of these things help to decrease stress hormones, decrease inflammation, and enhance the ability for the brain to make new connections, right? That's neuroplasticity. These are the things that are the antidote to toxic stress. We know this. The science is strong enough for us to now to move forward in applying that in our policies and practices.
For our parents listening, as well as our professionals,
Yeah.
what would you say for you are the three most important things that they can be focused on when it comes to healing in their homes and the awareness of ACEs?
I think one of the most important things that I can say for parents, for professionals, is that self-care isn't selfish. It's actually the foundation for us to be able to do anything for anyone else. And for a long time, I used to use the analogy of you have to put your own oxygen mask on first. And then there was a woman who said something to me, which I love, and I'm borrowing it from her, but I don't remember exactly who it was, but I want to give credit where credit is due. She said, it's not about an oxygen mask, it's about scuba gear, right? Because we're in it. We are in it. This is not a little bit of turbulence, right? This is a recognition that for many of us, it's a deep dive, right? And that we are walking this path. And the nice thing about the scuba analogy, I really like it. I don't do scuba because I'm afraid of underwater, but like I'm afraid of like the fish and stuff. But when you dive, what I understand is that you dive with a partner, someone who checks on you, someone who makes sure you're okay, so that if you get into trouble, right, you have someone who can help you out.
That's right.
That's what we all need. Someone who can check your regulator and say, oh, your oxygen is low. It's time for us to get back to the surface, right? We all need that. And the idea of, for many of us, and I think especially for parents, and especially for parents of kids who are adopted, right? We recognize that we're going to have to deal with the impacts of trauma and adversity for substantial periods of time. So let's have the right equipment. Let's make sure that we can do this in a way that we're not putting ourselves at risk, but we can actually do it sustainably. Right? Another thing I will just offer, my favorite self-care activity is the walk and talk. Walk and talk, I feel like, is legendary. I've been doing it for a long time, and I think now there's like all this science that's backing it up. But whether it's with a family member or a girlfriend or a guy friend or a loved one, trusted friend, whoever, just going that combination between exercise and being able to share what's going on in your life, having a witness to your experience.
That's right.
Also, good old-fashioned mental health, right? Like I do my weekly with my therapist. It's incredibly important to have someone, a person who is trained on understanding how these things show up and what are some of the best practices. What I get excited about is that there are more trauma-informed interventions that are being researched and validated every day. So that is one thing that I want folks to understand, is that it is never too late to begin your healing journey, right? There is something for everyone. If someone is not into therapy, then it might be yoga, or it might be going in that basketball game once a week, right? There are so many different healing interventions that can help to just regulate our biology.
It's beautiful. Something I learned from the book that I hadn't known was that in the first year, the brain forms 1 million neural connections per second.
Per second.
Per second.
Yeah.
Now, Thomas Vernon, that's mind blowing.
Yeah.
Because we talk about the brain developing, 90%, 95% in the first 3, 4, 5 years of life. Thomas Vernon says that as early as the second trimester, the fetus is capable of psychological processing. And Mitch Gaynor in The Sounds of Healing said as early as the 4th week after conception, the fetus is capable of hearing. So if we're looking at those first 9 months as well, in utero, we're talking about an astonishing rapidity of neural connections that are occurring. And I think we just, especially from the adoption community, we think that we adopt our little babies, we get our little babies when they're born, and we get them at 3, and we get them at 5, and therefore life's supposed to be perfect. 1 million neural connections per second.
Yeah. And also, right, what we see is that scientists and researchers have actually looked at, for example, the impact of mom's ACEs on the placenta, right? And what we see is that things like neurotransmitters like serotonin and levels of inflammation, levels of white blood cells tend to be more dysregulated in moms who have experienced high doses of adversity, or who have experienced their own ACEs. And so we recognize that part of the way that this dysregulated stress biology is handed down from generation to generation is actually biologically. And that means that when that baby is born, the adoptive parent, whenever that child enters their life, they have this incredible opportunity for the experiences and interactions that they have with the child to immediately begin healing any disrupted or dysregulated biology.
Wow.
Right? So that time skin to skin, or that eye contact, or that talking and what we call serve and return, right? When we look into a baby's eyes and talk to them and have big facial expressions, and then they return that back to us, that starts to lay down the foundation so that child's brain and body can develop in the context of healing, nurturing interactions. And the research shows that makes a profound difference in terms of risk for health conditions later on.
And there's no time limit on that.
Right.
That's throughout.
Right.
That's beautiful.
Yeah.
Thank you. I could talk to you for hours and hours, but I'm not going to do that because I know you have things you need to do, very important things. You are not going to be able to join us at our conference because you are going to a very important event.
Yes, that's right. I am going to be giving the keynote at the first ever Global Ministerial Conference on Ending Violence Against Children that's being presented by the United Nations. And so they've invited me to speak, and I'm really excited to be able to share this work with leaders from all over the world.
That's amazing. Can I say one last thing?
Yeah.
67% of adults have at least one ACE.
Correct.
12% have 4 or more. What happens when we go back one more generation?
That's a great question. And the answer is that we don't know.
Yeah.
We don't know because we just didn't track the data at that time. What we do know is actually the second week of October, the CDC released a new report looking at ACEs in high school students.
Wow.
And what we're seeing is that 3/4 of high school students report at least one ACE. And almost
3/4.
almost 1 in 5 report 4 or more ACEs.
Wow.
So we are seeing that it really is a public health crisis, right? And I believe that we can cut ACEs and toxic stress in half in a generation. But that is going to require that we switch our way of dealing with this from an every family for themselves approach to really transforming our systems so that we can do early detection, early intervention, and support evidence-based, trauma-informed supports for families.
Yeah. Thank you. The Deepest Well, phenomenal. And Dr. Nadine actually read the audiobook, because I do both. I do the book and then I listen to it. It helps me. Thank you.
I just want to say one more thing, because we were talking about brain development. There was a research study for kids who were in institutionalized care. They were in orphanages. And they were randomized into either care as usual or high quality nurturant caregiving. And in this study, they were randomized at age 2. And they did MRIs of these kids' brains. And at age 8, they did a follow-up MRI. And what they found was that those kids who were randomized into high-quality nurturant caregiving, they could actually measure on MRI normalization of the developmental trajectory of the white matter structures in children's brains.
Wow.
And so this is something that's literally has been measured on MRI. So when we're talking about the power of safe, stable, and nurturing relationships and environments, we're literally talking about changes in brain structure.
Yeah.
But in order for us to be able to do that, that means that we have to be well regulated.
We as the adults.
We as the adults.
As the
so
parents.
That's exactly.
And more importantly, the professionals.
Right.
The professionals have to be willing to do their own work.
Right.
So they're not afraid to step into the presence of parents who have to do their work.
That's
so
right.
they can guide them to show up for their children.
That's right.
It seems like a very simple thing. It is just a
That's
very
right.
scary thing.
Yes.
But we can all find courage.
Yeah. Yeah.
That's a
right.
great study.
That's right. Yeah.